Let us start with the topic that is the hepatitis A and E. I have combined these two topics, the hepatitis A and hepatitis E, because of some similarities. And these similarities are as follows. The both of these viruses, the hepatitis A and E, they are RNA viruses and they are non-enveloped. These are the similarities. The following are the similarities between the two viruses. Both are the RNA viruses and they are the NACT viruses. And they are enterically transmitted, means they have the fecal-oral route transmission. They are primarily transmitted by the fecal-oral route, and the hepatitis A and E both infect the enteric tract. So the hepatitis A is also called the enterovirus 72. Hepatitis A, the other name is the enterovirus 72. And clinically, they cannot be differentiated, and the hepatitis A and E both cause the inflammation of the liver, but no specific treatment is required. These are the self-limited diseases. They cause the self-limited hepatitis. So they need the supportive treatment only. And as you know, the chronic hepatitis and the carrier state both occur in the hepatitis B and C, but in case of the hepatitis A and E, the they do not cause the chronic liver disease or the carrier state. So these are the some similarities. And now the differences. What are the differences between the hepatitis A virus and hepatitis E virus? Look at the over this table. The hepatitis A virus, the key features are the following. The hepatitis A virus only has one genotype, while the hepatitis E virus has four genotypes. And if someone acquires the infection, the immunity develops for the lifelong in case of the hepatitis A, while the natural immunity in case of hepatitis E infection is short-lived. Fortunately, the in case of hepatitis A virus, the vaccine is present. The vaccine is present for for the A virus, hepatitis A virus, while still the in case of the E virus, the vaccines are in trials. There is no vaccine available. Uh, and regarding of the prevalence of a virus is less than zero point 0.1, means the disease is prevalent in less than 0.1%, while the prevalence of the E virus reaches about 20% of the global population, and still it arises in the children, adults. The severity hepatitis A is less, while it is more severe in particularly in the pregnant females. The severity is more in case of the E virus, and it is less in case of the A virus. The mortality rate is in case of A is less than 0.4%, and the mortality rate of E viruses increases. It increases in the pregnancy up to the 25%. And both of these viruses cause the waterborne disease, waterborne hepatitis, and it is more in case of E virus. Incubation is no, in case regarding the incubation, no significant difference is there. The incubation period in case of A is the 4 weeks, while in case of the E is 5 weeks. So these are some differences. Let us come to the forward. Now the hepatitis A virus. Hepatitis A virus is also known as the enterovirus 72. It causes the infectious viral hepatitis. It is RNA virus, and it is NACT virus. Incubation is about the 4 weeks, just similar to the hepatitis C, and they cause the self-limited hepatitis. There is no carrier or chronic infection, no carrier state or the chronic hepatitis occur in the hepatitis A, and rarely, infrequently, the A causes the fulminant hepatitis. The prevalence rate is lower. It is about 0.1%, and it increases as the age increases and reaches 40% by the age of the 50 years. So as the age advances, the prevalence rate increases, and it is globally distributed. Epidemics and the endemics areas are present globally. Endemic areas, the endemic countries which are with a poor sanitation and hygiene, the hepatitis A is endemic in these countries. The epidemics also occurred, and they are not infrequent in such nations, uh, and in such a nations, the anti-HA hepatitis A virus antibodies are present by the age of 10 years. So, in a nutshell, endemic, there are the it is hepatitis A is endemic, as well as the epidemics may occur. Transmission, the primarily the transmission is by the fecal-oral route. The It is by the ingestion of the contaminated food and water, and the food and water that is fecally contaminated. So the transmission is by the fecal-oral route. And in the developing countries, the waterborne and foodborne hepatitis acquires through the diet or the food. The most importantly, the shellfish, the shellfish type of the food that is taken, and in this way the waterborne and foodborne hepatitis occurs. In the developed countries, these are the modes of the transmission: person to person, with a close contact, in an intimate contact. So this is also the route of transmission of hepatitis A, and it also is transmitted by the intrafamilial spread. And in case of the special settings in schools, nurseries, daycare centers, it may be transmitted in such situations. And possibly the sexual mode of transmission also occurs. These are the shellfish. Those people who eat the shellfish, they probably may be suffering, may be affected by the viral hepatitis A virus. Risk groups. The groups, the people who are at higher risk are those who are the international travelers which travel from the countries towards the endemic areas. They are at higher risk. The caregivers, they are at increased risk. Homosexuals and the injection drug users and persons with the chronic liver disease, they are at higher risk to get the hepatitis A virus infection. The clinical features, they are similar to the other type of hepatitis viruses. The other viruses, as they cause the hepatitis, so the features are similar. However, the hepatitis A virus is a self-limited disease. It causes the mild or asymptomatic hepatitis. There is no chronic or carrier state, and rarely it causes the fulminant hepatitis. Most cases resolve within the 2 to 4 weeks. So it is a self-limited disease. However, it exists. In children, the acute illness, the acute hepatitis. In case of the acute hepatitis, the in children aged less than 6 years, 70% of the infections are asymptomatic. And in case of the older children and adults, where the infection is symptomatic, the symptoms occur in case of more than 70% of patients. So the older children, adults, they are symptomatic in 70% of patients, while the children less than 6 years, they are asymptomatic.